So the other day it snowed where I live. It finally snowed, and I just get stoked when it snows. So just roll a clip.
It's snowing, and I love it when it snows. I get so excited. It's the best day ever because it's finally snowing.
Unfortunately, not everyone loves it when it snows like I love it. A lot of people don't like the winter. In fact, they see a pretty significant mood decline when it gets cold and dark out. And if that mood decline is bad enough, psychiatrists call it seasonal affective disorder. So today in this video, we're going to talk about what seasonal affective disorder is, but also what it isn't, where that distinction is, and why that distinction matters. Before we go any further, please remember that I am not a doctor. I'm not your doctor. I'm not qualified to diagnose you, to give endorsements of medical advice or treatments or medications or anything like that. I can't do that, and I won't. This video is really just to educate you on existing mental health information. This video is for education and entertainment purposes only. So now you know what I can and I can't do for you. Let's get into what is seasonal affective disorder. Seasonal affective disorder is a depressive disorder with seasonal patterns. So that means the symptoms that you're looking for, the symptoms associated with seasonal affective disorder, or S.A.D, one of the best acronyms in the game, are similar to that of major depressive disorder, or what we commonly know as depression. So I'll give you a few examples of symptoms to look out for. This is not an exhaustive list. This is not all of them. Just giving you a list so that you understand kind of the context of what we're talking about when we say depressive disorder. So it's things like a persistent low mood, things like a loss of pleasure, doing the things that you normally like to do. It's this lethargic feeling that kind of comes with feeling tired and achy and fatigued a lot, a lack of energy. You sleep for a long time and then it's difficult to wake up. You become less social, you become irritated, things like that. Again, not an exhaustive list, but just some examples. So it's all of those, but it only really happens in a seasonal pattern. So when the symptoms start, we call that onset, and when the symptoms stop, we call that remission. And so many people with seasonal affective disorder have a fall or winter onset, go through the fall and the winter, and then have a spring-summer remission. It's not all of them, though. While that's the more typical, more common type of seasonal affective disorder, there is something called summer S.A.D, in which that's reversed, and you actually feel more S.A.D in the summer, fall, and better in the summer, spring, and you feel better in the fall, winter. Seasonal affective disorder is also more likely to be found in people at higher latitudes, so farther away from the equator, in people that are younger, and in women, interestingly enough. So that's what seasonal affective disorder is. It's depressive symptoms at one time of the year and not at another time of the year. And that just a repeating pattern over and over. Every year it's onset, remission, onset, remission, onset, remission. If you're diagnosed with seasonal affective disorder, your doctor might do a few things. First is something called phototherapy or light therapy. Essentially, you just sit in front of a decently bright light in the morning for 30 or 45 minutes, and that's said to help a lot of people. It also has pretty low side effects, right? You're not really putting anything in your body. You're just kind of staring at a light. I guess if the light is really intense, that could be harmful to your eyes, but you can always adjust that. Another thing you could try is vitamin D supplements. Vitamin D is produced when your skin absorbs sunlight, and so with the lack of sunlight, a lot of times seasonal affective disorder is associated with, I don't want to say caused or whatever, but associated with a vitamin D deficiency. And so you can just buy vitamin D supplements over the counter, or if it's bad enough, there are ones that can be prescribed to you. Another thing is talk therapy, or what we know as cognitive behavioral therapy. That wouldn't really help with the symptoms as much as it would help with the coping mechanisms of the symptoms, right? Here's how I feel, here's why I might feel that way, and here's what I do when I do feel that way. Cognitive behavioral therapy is a solution for a ton of people. It's pretty widespread. And aside from costing money and time, again, you're not putting anything into your body, so the side effects are manageable. The last thing is, if it's bad enough, a doctor might prescribe an antidepressant for you. And I'll touch on that a little bit later, but just know that that is out there as a potential treatment. So now that we know what seasonal affective disorder is, we should talk about what it isn't. And then afterwards, we'll explain why that distinction is important. In order to show you what it isn't, I have two things for you. First is from the Diagnostic and Statistical Manual, which is basically a giant book of all the mental health disorders that you could possibly have. And we're on the 5th edition. That's from 2013. And another is a study that actually looked at seasonal mood changes from all the way back in 1988. So we'll get to both of those. The first thing is that DSM-5. The DSM makes a few important notes to take into consideration before diagnosing someone with a depressive disorder with seasonal patterns, right? The first is that before diagnosis, one must screen for what they call psychosocial stressors. Psychosocial stressors are essentially just a fancy way of saying things that stress you out. Things that stress you out could include unemployment, exam seasons, breakups. If those stressors are happening annually, the DSM says take that into consideration because it is likely that that stressor is contributing to the depressive symptoms. And so that makes sense, right? A lot of people are unemployed in the winter if they're seasonal workers. Exam seasons come, that can be stressful as hell. It's important to remember that addressing those is just as important as addressing the mood shift, right? Because oftentimes they can be linked. The other thing I noticed is that within a span of 2 years, this patient has to have had 0 reoccurrences of symptoms outside of that season. It also says that even outside the span of those 2 years, the number of depressive symptoms and their intensity has to be vastly focused on inside that seasonal pattern or that seasonal period. That said, the DSM is a book from 2013 and you're a human being right now. So grain of salt there, right? Everyone's different and every person's experience is different. But hopefully that gives you some kind of insight into where that distinction is between seasonal affective disorder and potentially something other than seasonal affective disorder. The other thing is the study that I found, and the study is called Seasonal Changes in Mood and Behavior, and it's a cluster analytic approach, which is a form of statistical analysis. Okay. So in the beginning of the study, in the introduction, this study references other previous studies saying that these studies confirm impressions arising from our seasonal affective disorders program, namely that seasonality can be viewed as a dimension that spans clinical and normal groups. That's to say people that are diagnosed and people that are not diagnosed. And this mood change affects both groups. Thus, the study claims it is plausible that symptoms found in seasonal affective disorder patients, both winter or summer type, can also be demonstrated in healthy individuals, but to a lesser degree. So this study, this is the introduction, right? We haven't proven anything yet, but the study is going off of the idea that many people feel a mood decreased seasonally. And it is a few of those at the extreme end that are diagnosed or should be diagnosed with seasonal affective disorder. The study then essentially just did an entire survey. They called up a bunch of people in Maryland, of all places, and gave them a survey over the phone called the SPAQ, or the Seasonal Pattern Assessment Questionnaire, which measures a person's mood changes based on the season. At the end of the study, the results indicate that seasonal affective disorder represents the extreme end of the spectrum of seasonality, and that, by inference, a large percentage of the general population is affected in various ways by changes associated with the season. Seasonal affective disorder is reserved for the people with the worst of these spectrum of depressive symptoms that occur seasonally, apparently for a lot of people. So why does it matter, right? Who cares if you get a seasonal affective disorder diagnosis, whether you fall into that extreme category or not? In the end, it's just semantics. Well, remember when we talked about treatments and we talked about antidepressants. Antidepressants are medications that can take 4 to 8 weeks to begin working, and sometimes even longer. And for each person, an antidepressant will work differently. For some, it'll work completely and perfectly. For others, it won't work at all. And for the rest of the people, it'll work somewhere in the middle of that. And each person will have a different reaction to all the different antidepressant options out there. Coming off of an antidepressant, if the one you're on now isn't working and you need to switch, or if you decide that you don't want to deal with the side effects anymore, coming off of it is not an easy task either. Often can take weeks or even months to safely come off of that medication. Antidepressants have a long-term implication for your life. And so you should understand why you're going on to an antidepressant before making the commitment to that treatment. I'm not saying they're good or bad, that's just the facts. Another reason is that diagnoses matter. Right? If you're diagnosed with, for example, seasonal affective disorder, but it doesn't totally fit, getting that diagnosis changed can be really difficult, and that could affect the treatments you have. And so getting the right diagnosis or making sure that your diagnosis fits with what you're feeling is really important, because that diagnosis is going to impact the treatments you have and the treatment options you have in the future. Hopefully after watching this video, you have a better idea of what seasonal affective disorder both is and isn't, and why the difference there matters, right? You now understand some of the treatment options and the benefits and limitations of a few of those treatment options. Right? The idea is that we've made the dark, scary, guessing game world of mental health a little bit clearer for you. And in that way, you're able to take control of your mental health for both your sake and the sake of your loved ones. That's the goal here at wisedown.com. And if you've liked this video, consider subscribing. And if you want to learn more and see more of our stuff, consider signing up for our newsletter down below. Every month, we just give you a recap of all the content we've created so that you don't have to go search for it yourself. You can just click on what you like and leave what you don't. Other than that, have a great winter, and I hope it snows like hell.